And good morning. The pre-recorded show today, it is For Your Health, a presentation of Medica Pharmacy. And in studio with us this morning, Alyson Schwartz. And good morning, Alyson.
Good morning, Roth.
Well, a lot of things go on in the month of November, besides Thanksgiving. Of course, we do want to remind everybody that it is Diabetes Awareness Month. You at Medica have many things to offer people that suffer from diabetes.
We do. We have diabetic shoes and socks, and I was actually a little bit amazed at what a really good pair of socks will do for you. We also have support and compression hose, and a lot of diabetics have poor circulation, so those compression hose are of utmost important to keep those lower legs healthy. We do diabetes education. Diabetes, of course, diabetics are more at risk for chronic diseases and illnesses, so we offer vaccinations of all sorts to help keep you healthy. We have all kinds of medical equipment that may assist you, a full line of nutritional supplements, and of course, obviously the regular prescription medicines. But the education part, the diabetic shoes, the nutritional supplements, the compression hose and socks, all of those are extremely important for diabetics.
And a special day coming up on the 14th of this month at Medica Pharmacy, correct?
Yes, we are having a Diabetes Day on the 14th, so we're going to be doing free blood sugar testing, and we're going to do free fittings for diabetic shoes. And if you happen to get your first pair of diabetic shoes, then you're going to get a free pair of socks. Now, most insurances pay for diabetic shoes, and not everybody qualifies, so you do have to qualify. There is a lot of paperwork involved. We take care of that for you. So if you have any interest in getting a custom-fit pair of diabetic shoes, there's lots of nice styles. They have some really good-looking shoes. They're very comfortable. They're even good for non-diabetics. There's quite a few of us at the pharmacy that just have a couple pairs just because they are very comfortable if you're on your feet all day. So stop in on the 14th. Where anybody that stops in and participates either by doing a shoe fitting or getting your blood sugar checked will be entered to win a $50 Chamber gift card. So definitely stop in on the 14th and see us.
All right. We have a couple of topics on the agenda today, and let's start with the first one with Medicare enrollment.
That's right. Medicare enrollment starting last year moved up. So this year they're keeping with those earlier dates. It is open now. It was open since October 15th, and it ends on December 7th. So if you have any desire to choose your own plan, and trust me, you need to have a desire to choose your own plan, you need to have that done by December 7th. And the reason it is so important is I have so many people that love the plan they're on right now. And that's great if you happen to be one of those real rare instances of actually loving your insurance company, because not many of us do. But if you do, it may change next year. Like the drugs that you are on now may not be on their formulary next year. The formulary of an insurance company, unfortunately, has to do with what rebate dollars do they get from the drug manufacturers, what kind of deals can they slide together over their little table talks that they have. And so what you're on now may not be on a formulary next year. The other thing that we're seeing happening is many of these Medicare Part D plans are joining forces with some of the chain pharmacies. So there may be a plan that looks like it's really, really inexpensive for you to get your drugs, but maybe they're only partnering with a CVS, and we don't have a CVS here. So maybe those prices only apply if you get your prescriptions filled at CVS. So if you want to go to a certain pharmacy, and I'm not saying you have to obviously go to Medica, but maybe you want to, whether you choose Medica, Hearst, Kroom, Walmart, Walgreens, Kroger, if you like that pharmacy, you want to make sure that the drugs you're on are going to be that price at the pharmacy of your choosing. So when you're looking at those plans, you can actually put in whatever pharmacy you choose, and it should more accurately depict the prices. If you don't know how to do that or are unsure of it, please call Medica for an appointment. We do set up consultations to help you choose your Medicare plans. We'll give you the options of usually the top 3 or 4 that seem to be the most beneficial and affordable for you. But they change every year, and so you need to look at that every year. Even though you think, I've never had a problem before, you don't want to be February and all of a sudden realizing that you picked the wrong plan.
We still have that donut thing in Medicare?
We do. It's shrinking. It's getting smaller. It's every year. I think they, it's $50 more this year that you get to spend before you're in it. So it's like $47.50 you have to spend before you're in it. They made that provision a few years ago that they'll pay like 50% of a brand name drug if you're in the donut hole. So there are still stipulations of that, and they are shrinking it slowly over time. Now, that's something else that you'll find out if you review the plans, is it will actually tell you approximately when you will hit that donut hole and what your costs will be when you're in it. So again, another important thing to look at when you're looking at those plans.
Okay. And again, Medica Pharmacy will sit down and do a consult with anybody that they'll call and make an appointment.
That's correct. We have a number of our staff. We've pretty much trained almost everybody there on how to do it, and so we do schedule appointments for that. It does take a little bit of time, especially if it's a husband and wife that want to do it together. You need almost an hour of your time to do that. So if you have more than one person in the family that needs to do it, make sure you let us know that, because we pretty much schedule them every 30 minutes or so apart to kind of get them done. And there are days where we do 6 or 7, and there's days we might only do 1. So, but we do have the appointment calendar for everybody to access. So just call up there, get yourself an appointment, and then we'll go over. Make sure you bring a list of all your medications, because that's very important when you're choosing a plan.
You know, you talk about the Medicare thing. I received notification from my insurance company about the Healthcare Reform Act changes of what it'll provide me. Well, actually, it doesn't provide me much, but there are some things that change because of the Healthcare Reform Act. So people probably are getting notified by their health insurance provider of what those changes are. And in mine, again, most of them seem to apply to the female, but but there was something like a covered female who has a baby can receive a free breast pump. And with having our daughters in our family have had some babies and got more on the way, we know how much those things cost, and that's going to be under Healthcare Reform Act. Covered insurance things will provide that.
Right. Some insurances, and right now it's interesting, a lot of private plans won't pay for a breast pump, but Passport Health Plan will pay for 3 months. Now, at the end of 3 months, they're rentals. They're rentals, so they'll pay for the rental of them, because those machines are expensive. I mean, they're worth it. They're worth it. I mean, to breastfeed a baby has more benefits than you can ever really describe. So you can rent those, and I mean, it'd be interesting to get more insurance companies to pay for it. It'll be interesting to see how long they'll pay, because right now 3 months is the mass time. Other than that, anybody can rent them, and you put a down payment on, or not a down payment, but a deposit, and then you pay so much per month, and then you bring it back when you're done with it.
So keep watching your mail, and as your insurance provider will be sending you, because I think the Healthcare Reform Act, some of the major provisions start in this coming January, I
believe that's correct. Yeah, and since we mentioned Passport, I think a lot of people out there that are on Medicaid and Passport, they probably learned last year that, we had a bunch of companies come in that kind of divided up the Medicaid and Passport population. So all of a sudden there were 4 different companies out there, and we've always had the Passport region, Louisville and Bardstown. We've always just had Passport. The rest of the state had straight Medicaid. So we had other managed care organizations that came in trying to prove that they could save us money, and I don't think they're proving anything of the sort. But anyway, Passport actually has to get farmed out this year as well. Now, from what I understand, and this is coming from some people that have been in Physicians to Children's office, that Passport will be farmed out to other industries and other companies, and you will be getting letters if you're a current Passport patient that you have the right to choose which one of these companies you take part in. And if you don't choose, you will automatically be enrolled in one of them if you don't have a say. But from what I understand, Physicians to Children will only accept Passport. So if you go to Physicians to Children now with your kids that are on Passport and you want to continue to do so, I am almost positive you will have to choose Passport. Don't let them choose you into another plan, or your doctor won't accept that insurance. Please contact Physicians to Children to verify that that's correct. But that was what one of my employees was told when she was in there. And so I'm kind of going secondhand here, and I hope that that's accurate. But, with the changes coming up with Passport and Medicaid, you need to make sure that whatever plan you're going to be on, your doctors, your dentist, your whoever is going to accept that plan.
There is a Chamber of Commerce function today at noon, and Passport is the sponsor of that event, so they'll have representatives there. So if somebody's got a question about that, I can assure you that a Passport representative will answer that at noon today at a Chamber of Commerce, their quarterly function today. It's call the Chamber office to get more details. But, they're very, very important for people to, in this what we're in right now, kind of a changing thing of some healthcare things, and people need to read what's sent to them in the mail. It may look like, you may say, oh, that's just junk mail. Well, it very well may have some information in there that you need to read.
That's correct. And then there's so many people. I mean, I know that there are social workers out there that help take care and help enroll people, but, it's really time for people to really be proactive and be accountable for their own plans. Yes, maybe you're a Passport or Medicaid patient, but it's your job to stay on top of that and make sure you're in the plan that you need to be and that you're enrolled on time and you have coverage. So, you need to be proactive with that as well so that you don't find out come first of the year that all of a sudden your doctor doesn't take the plan you have.
Speaking of proactive, we got to be proactive in taking care of ourselves, besides along with our insurance policies or plans or whatever. Cold and flu season is here. How about, I think somebody said it was 28 this morning at their house.
It was frosty. I actually stayed the night over at my parents' house last night, and so I didn't have a garage to put my car in, and I've forgotten how much I hate scraping my windshield. So it is cold, and cold means you stay inside more, and you have everybody's germs around you and on you, and you get sick, and we don't want you to get sick. I mean, yes, we like to fill prescriptions and make you feel better, but inevitably we would like for you to not have to be sick because nobody likes to be sick. There are some sporadic cases of the flu already from September in Kentucky. If you have not gotten your flu shot, go get it. I know we're getting low on flu vaccine, so it is time, if you have not gotten your flu shot, to get it. It takes 2 weeks for it to be build immunity in your system. If you're anti-flu shot, anti-needle, allergic to eggs, you can't take flu shots. There is the homeopathic option that's perfectly safe for all ages, pregnant women, no drug interaction. So there is an option if you just really, for whatever reason, can't or won't do a shot. There's also the nasal spray. Tastes a little odd if you've ever done it. So some people don't like that. But if you have any reason why you can't do the flu mist nasal spray or the flu vaccine, then the Influenzium homeopathic drops work really well. This is our first year carrying them. I have been told by people that carry them that they are highly effective. So there's a few of us experimenting with that this year. We'll let you know how it goes at the end of flu season. We're hopeful that it is as good as they say it is.
What does homeopathic mean in this case?
Homeopathic is anytime you're doing like treats like. So it's very similar to the flu virus. It's little minuscule, so diluted down flu vaccine, but this is an oral drop. So they basically, when you make a homeopathic, you take whatever antigen you're working with and you dilute it, typically in alcohol, dilute it down. And so it creates that immune response in your body so that you start to build those antibodies for the flu, just like if you were given a flu shot. And so it fights that flu off. It's same works. We sell this year, I've been told by people with allergies, it's been the worst allergy season ever. And we have a homeopathic allergy drop that we continue to run out of. We've had so much success in treating allergy symptoms with it that we're having a hard time keeping it on the shelf. So, and that's another one. Doesn't cause you drowsiness, doesn't give you that weird dried out head feeling. I mean, you don't really notice that you're taking, other than that your allergies are much better. So I actually have a nice young lady that I know very well that I've run out of it twice, that she's come in, and twice that she's told me that I've gotten her hooked on this great allergy stuff, and twice I've run out of it. So we're doing our best to keep it on the shelf, but if you have bad allergies and you're suffering, it's definitely worth a shot. It's really good stuff.
And it's not a shot.
It's not a shot. It's just some. You just put.
It's worth a shot, but it's not a shot.
Yeah, put a few drops under your tongue, and then that's all there is to it. So it's totally painless. So anyway, but we do want to prevent the flu. And even if you do get a vaccine, yes, you can still get the flu. No, you do not get the flu from the flu vaccine. I want to point that out there, but it does take some time to get that immunity. But they guess. Every year they guess with the flu vaccine. There's all kinds of different viruses, so they make their best guess, and they mix a few different strains of the virus into the flu vaccine. And every now and then they get it wrong. And even if they get it right, you may still get the flu, but the idea of a flu vaccine is that you're going to get less symptoms of it. So if you want to even do more to prevent it, there's a few things that we recommend. Obviously, wash your hands. Keep your hands out of your eyes and nose and mouth unless you have just washed them, because that's the easiest way to put a virus or bacteria in your body is by touching the eyes, nose, or mouth, any of that mucous membrane, so that you get those viruses into your system. Now, once they're in your system, the best way to prevent them is to make sure you have a really healthy digestive tract. And I know people always look at me strange because I'm always talking about digestion. But you have to have good quality bacteria in your intestinal tract to kill off bacteria and viruses. And you have to have good stomach acid. When you're on medicines that lower your stomach acid, you cannot kill off bacteria and viruses in your stomach. So that's something you need to be aware of. You don't absorb vitamins and minerals like you should when you don't have that good bacteria. So if you're never taking a good quality probiotic, now would be the time to probably try one. Put that good bacteria in your intestine so it can fight off bacteria and viruses, keep toxins out of your bloodstream. But when you have good, healthy flora, it actually synthesizes its own vitamins and minerals, so it helps to keep your body nourished. And when you're well nourished, not McDonald's nourished, but well nourished, you're healthier and you fight off infections better. So those are the first two things. The last three things are actually things that can be used preventatively. We have a product called Thymuril. It's got thymus gland extracts, a little bit of vitamin C, some echinacea, and a few other things in it that is a wonderful, wonderful immune booster. Stop in and ask any of my staff if they've ever taken it, and we all swear by it. I know most of us don't ever have it not in our house, because the minute you start to feel a little bit like something's coming down, if you start taking that Thymuril, it greatly reduces the severity. I'm pretty sure that most of us will tell you that within 48 hours, you'll pretty much feel like you've never had anything. So it's really, really good. If you're sure it's a virus, you start coughing, hacking, a little runny nose, something in your chest, we have a product called ViraClear. Now, ViraClear can be used preventatively. If you're going this time of year, you're going to hop on an airplane, go somewhere, start taking that the day before you leave. Take it while you're gone. It'll actually help prevent it. It's been shown to treat mono very quickly, like kids back in school within 5 days, as opposed to 2 and 3 and 4 weeks.
Wow.
It tastes delicious. It is a liquid. It's safe for 2 years of age and up. It's great to treat or prevent. We mostly use it treating. So you come in and your symptoms just started within the last 24 hours. We'll give you the ViraClear. You take it until your symptoms have been gone for 48 to 72 hours. And no side effects to that either. It just helps your body naturally to fight off viruses. And then the last thing is a chewable tablet called Esbiritox. And it's mostly echinacea, but it's really good for the younger kids because it's a kind of a citrusy tasting orange tablet. So it's not as good as the Thymuril and the ViraClear, but it is a good product. So, but the ViraClear and the Thymuril together will really help you feel better fast.
And you can take them together?
You can take them together. Actually, yeah, I had a horrible sore throat Saturday morning, and I started both of them, and by Sunday afternoon, I felt fine.
Well, you mentioned a few things that products in these products. Some of the things. What are some of those things? And we're talking all those last three things over the counter.
They're all over the counter.
Non-prescriptive.
Yep, they're all something you can buy over the counter. They're all products that are made by Integrative Therapeutics, and that's the supplement line that I will talk about the most if you come in looking for a recommendation. I do their products because they study and test everything. They study it for not only purity and make sure it's pure, make sure it's potent, make sure that it works, but make sure it doesn't have pesticides, heavy metals, any kind of toxins in it. It's the only supplement line that the Mayo Clinic will even allow inside their doors. So they guarantee their products. If you want to try one of their immune products, one of their sleep products, you don't like it, you just bring it back. You get a refund. So you got to trust a company that does all this work. They follow very strict guidelines, but they back their products up. You typically go buy some over-the-counter random brand of whatever it is that's supposed to make you feel better. And if you don't like it, that's just too bad. But we pretty much want to talk to you. We don't want you to just come pick up a random product and buy it. We want to make sure you're getting the right product so that it does work. But the things like thymus gland extracts, thymus glands are very important to your immune system. So sometimes that kind of grosses people out. We have an iron product that has liver fractions in it. Well, because that's where you make iron. And so some people are like, ew, it's got liver fractions, it's got thymus gland in it. Well, yeah, but that's something that's natural to your body, so it's going to help support your body naturally. So now that being said, just because it says it's natural doesn't mean it's good for you. So be careful about that. Echinacea has long been shown to be kind of an immune stimulant type herb, as has like golden seal. Everybody's like, well, what about vitamin C? Well, vitamin C is the first thing that gets burned up when you're under stress. And if you're sick, you're under stress. So vitamin C, 1,000 to 2,000 milligrams a day, at least when you're sick, is very important. Most of these immune products have some vitamin C in them. So they just have a wide variety of stuff. The ViraClear is its own kind of little entity. It's something you look at. It's like EPS 1760, something to that effect. So it's one of those kind of compounds that they discovered. So it doesn't really have like this honest to goodness name, but it's been studied in
which we wouldn't know anyway.
Right? Yeah, it's one. I don't know. I didn't learn it in pharmacy school. I can tell you that. But it's one of those things that they have been studying for a while now, and it's been the main studies are mostly upper respiratory infections and colds. And the biggest one is mononucleosis. They've seen such great benefits of it. I know there's a pediatrician in Louisville that uses it exclusively for her any patients that have mono. She puts them on ViraClear. So it's I know everybody immediately thinks antibiotics. Z-Pax is the big one. Levaquin. They all have a lot of risks to them, and we are seeing more and more people that are doing Levaquin or Cipro or Avelox and are getting tendon damage. And it's very interesting because it doesn't always show up right away. It might show up while you're on it, but it might be you felt really bad, you took that antibiotic, and then 2 months later you're like, I'm back to par, I'm going to start working out, and on that first workout you get injured. And it takes forever to heal. And you're like, I can't really explain it. It's not really a muscle. It's kind of, but I don't know. Nobody can really figure out what it is. Well, it might be that Levaquin or that Cipro or that Avelox caused you to have weakness in that tendon or ligament, and you strained it. And we see that a lot, and it's alarming. So you need to be aware that just because you have a runny nose or a stuffy nose, you don't need an antibiotic all the time. And so, I tell people the minute you start to feel bad, try one of these products. If you still feel bad in 3 days, sure, then go to the doctor and, get an antibiotic if you really think it's necessary. Zithromax has just had a warning about heart attacks. And so you have to be careful when it comes to any kind of drug. So the best that you can support your body by good nutrition, good foods, exercise, get outside when it's cold, get some fresh air, wash your hands. You're gonna be thankful in the long time. And you want the thing about some of these products I recommended is they don't kill that bacteria. They actually support your body's immune system. The difference between that and antibiotic is antibiotic actually suppresses your immune system by killing the bacteria for you, so you don't get a full-out immune response. And so you're actually going to be a little bit more prone to getting ill again in the future. So the more that you can create the ability of your body to protect itself, the better you're going to be in the long run.
And I think we have a magnificent thing, the human body, and it does a real good job. And sometimes, I think you've described some ways where we try to cure or do something to an illness, and we may do some damaging to some other things because sometimes getting the cure is a little bit dangerous.
That's right. Yeah. I mean, everything has a side effect. And I tell people, drugs save lives, and I went to pharmacy school for a reason, and pharmacology can be a great thing, but the physiology of the body is always the way to go. Yeah. And no matter what super drug we make, it's never going to replace the way the body is meant to work.
Yeah. You said it much better than I did.
You said it well as well. Thank you.
Okay. Alyson Schwartz, our guest this morning, or actually the host this morning of For Your Health on Medica Pharmacy. And again, as we begin the first day of November, we begin looking at Diabetes Awareness Month. We begin looking at cold and flu season. It's a busy month in November.
It is a very busy month. And then, I better mention, it's holidays around the corner, and they're very, very stressful. So, you might need a supplement to help you with stress. And I can help you with that, too. I might even have some samples in the pharmacy. So come see us. But, it's holiday season. It's cold. We're trying to fight off illnesses, and we're trying to, pick out Christmas presents and prepare our Thanksgiving turkey, and everybody just needs to remember to take time to enjoy it. Enjoy your family, your friends, yourself. Take some time that you need to just take a few deep breaths every day.
Because you have spoken to us and to others, I know, on how damaging stress can be to our wonderful, magnificent human body.
It is. And the most joyous time of the year somehow seems to always be the most stressful. I mean, what would it be if we could go to Black Friday without somebody getting in a fight over something, Crazy.
Okay. Alyson, we'll see you in a couple of weeks. Have a stress-free couple of weeks.
I will.
Okay. and we'll see you. That's our program today for Medica Pharmacy. Stay tuned. We've got more coming up here on WBRT.